Welcome. My name is Dr. Richard Van Enck, and I'm the Director of Infection Prevention and Epidemiology for Bronson Healthcare. And we would like to talk with you about a topic that is getting a lot of attention these days, and it has to do with reproductive issues and the COVID-19 vaccine. And I'm very happy to be joined by two of my colleagues at Bronson, Dr. Amanda Walker and Dr. Sarah Sharghi. So, Dr. Walker, could you maybe introduce yourselves to our listeners and tell us how what you do and why you're interested in this topic?
Sure, thank you. Thanks for having me today. I'm Dr. Amanda Walker. I'm an OBGYN at Bronson. I've been here for 8 years now, and I've been working a lot with pregnant women, unfortunately during the pandemic, and I have an interest in this because I am hoping that we can provide some more information to women about the COVID vaccine and pregnancy. I've had a lot of interaction with patients with COVID in their pregnancy, and we've seen some not great outcomes. So I feel like I want to help everyone make the best decision so we can improve outcomes for patients.
Mm-hmm. Great. And Dr. Sharghi, could you tell us a little bit about yourself and why you're interested in this topic?
Yeah, so I'm Dr. Sarah Sharghi, and I am a pathologist at Bronson. And so I have the unique responsibility of taking a look at placentas after the patient delivers, of both patients who have been infected with COVID and patients who have been vaccinated. And in addition, as a infertility patient myself, you know, this topic is kind of near and dear to my heart in that I had to investigate the COVID vaccine and kind of do my own homework before I felt comfortable getting vaccinated. I am still undergoing infertility treatment, but I did have a successful pregnancy back in 2019. And now we're looking to get pregnant with our second child. And actually, I did conceive after getting vaccinated. So I just wanted to, you know, maybe be able to reach out to patients who have similar concerns as I did with infertility or fertility in this space and connect with them. And I can totally relate to the hesitancy that some patients feel putting anything in their body that's, you know, maybe foreign or you know, any new medication treatments when you have some fertility concerns. So I can relate to that.
That's fantastic. So why did we pick this topic to talk about? And there are some reasons for that. We get a lot of questions about this in our social media feed. And we get questions as Bronson people, providers get questions about this. So why is this such an interesting topic in these days? Well, there's a lot of people that are of childbearing age in the population, and they are getting COVID. And so the vaccine is approved and is indicated for those people. The recommendations are for those people to get the vaccine. But some people have a little bit of hesitancy about that, and it has to do with the way the clinical trials were done. The initial clinical trials for COVID vaccines did not specifically recruit pregnant patients. They included patients who were pregnant, but they didn't recruit them, and they didn't have a separate study for pregnant patients. They do now, but at the time, it looked as though the amount of data that we had initially was kind of thin in terms of pregnancy. Now we have a lot more information. So we want to share with you all what we know now about pregnancy and female reproductive issues and the COVID vaccine. So I think we're going to have a great time talking about this interesting topic. So Sarah, what do we know about vaccination and fertility? What have you experienced, and what does your research show about that?
Yeah, so the message is that there's no adverse effects on fertility and the vaccine, with the vaccine. They have not found any adverse effect on ovarian function, egg quality, sperm quality, fertilization rates, implantation rates, and ongoing pregnancy rates when compared to when comparing vaccinated to unvaccinated individuals are the same. So I think that there's really, most recommendations say that vaccination shouldn't be delayed even outside of the first trimester. There's really no reason to delay vaccination if you're pregnant or trying to conceive. And the only instance where I've seen a recommendation to postpone vaccination would be in the infertility space. Sometimes it's recommended that you wait 3 days either before or after an infertility procedure, mostly because the vaccine can be associated with low-grade fever. And so they want to make sure that your procedure isn't canceled, or that the low-grade fever isn't related back to the fertility procedure itself.
And I would just reiterate that I've had a lot of fertility patients working with during this decision time of getting the vaccine, and have done a lot of research similar to Dr. Sharghi. And I think it's overwhelmingly abundant that it does not have any impact on fertility for men or women. I know there's been a lot of questions on both sides, so I would absolutely agree with that.
Right. I was not aware of that issue in terms of fertility treatments, but just to reinforce that it's not that they shouldn't get vaccinated, but it's a timing issue. And we have seen that with other areas of medicine and other types of patients where they should get vaccinated, but sometimes you have to time it with something else. And so it's a matter of timing. It's not an issue that you shouldn't get vaccinated at all. So Amanda, what do we know about the pregnancy experience, or is there any difference during pregnancy with vaccinated versus non-vaccinated patients, or what is there any effect that you've been able to see in the pregnant patient with vaccination?
I think that's a question that I get asked every day. And so again, I've done a lot of reading and trying to look for good answers for that. I think the overwhelming amount of evidence, and we have tens of thousands of women now who are pregnant or were becoming pregnant that have received the COVID vaccine. So a huge amount of evidence we've learned from now that there is no effect on pregnancy. And also, unfortunately, like I mentioned in the beginning, we have a lot of evidence of COVID-19 infection in pregnant women and all of the negative effects that has on the mom and baby. So I think, it's become overwhelmingly clear, so much so that ACOG, which is our, kind of governing council for the American College of Obstetricians and Gynecologists, they've now updated their statement to say that now they enthusiastically recommend the COVID-19 vaccine for pregnant women and those breastfeeding and those wanting to become pregnant. ACOG is a big college and organization, and they don't make recommendations lightly. I don't think I've ever seen them make a statement that says enthusiastically. And those are the experts that we really rely on, that have reviewed the evidence and spent even more time than us regular clinicians have spent. So I really feel 100% confident that it's safe in pregnancy and really is the best thing for moms and babies. We know that COVID-19 infections have had a lot of poor outcomes for moms and babies. They affect growth issues. They have caused stillbirths. They've caused death for mom and baby. And if we can reduce that risk with the vaccine, I definitely recommend that.
Mm-hmm. Sarah, anything to add to that one?
No, I would just say that, when it comes to, again, like the developing fetus, we haven't seen any adverse effects on infants born to vaccinated mothers either. Even the CDC has published some data looking at women who are vaccinated before 20 weeks now, as well as earlier studies that were more focused on women who were vaccinated in later pregnancies, and there has really been no increased risk of miscarriage or birth defects that have been associated with vaccine. The rates of those complications are generally equal to the background population. And importantly, there's been no clustering of birth defects seen at greater frequency in those that have been vaccinated. So that's all really positive information as well.
Great. I'd like to add one more point here and put my immunologist hat on and say that many people don't realize that when you get vaccinated during pregnancy, the mother makes an immune response to that vaccine and the mother is protected. But what people don't understand is that that protection passes to the fetus, to the unborn child, and that baby comes out protected. And so you're really vaccinating two people when you vaccinate a pregnant patient. And so that's an additional benefit. It's like 2 for 1, and we only charge for 1. So it's really a bonus when we vaccinate people during pregnancy. Yes. Dr. Walker, when you're delivering a patient, would you rather that patient be vaccinated, or would you rather that patient not be vaccinated? What does the birth process look like in those two types of patients? Is there a difference?
Yeah, I think that's a good question too. So myself, and I think all of my colleagues, feel like we definitely are more comfortable working with vaccinated patients. There are a lot of people who are asymptomatic with COVID infections that haven't been vaccinated, and we aren't routinely testing every laboring mom. And so the safest thing for our providers is certainly to be around vaccinated patients. The birthing process is, as you know, there's a lot of breathing and particles and a lot of close contact. And to protect our nursing team and providers, it really is preferred for all of us to be around vaccinated patients as much as possible. Absolutely. The process, I will say also, if someone has a baby that has to go to the NICU for whatever reason, there are pretty significant restrictions for unvaccinated visitors, and it really is a different experience that way too. So being vaccinated definitely protects both the mom, the staff, and people in the NICU and other babies.
Mm-hmm. Mm-hmm. Sarah, do you know of any studies or any difference in the baby after it's born, if the mother is vaccinated or not? You know, I indicated that baby is somewhat protected for maybe 28 or 30 days from the mother's bloodstream. But is there anything that you know of that those babies, you know, look different or act different, or they're medically different that you know of?
No, I think that the babies that are born to vaccinated mothers are essentially the same as those born to non-vaccinated mothers, as long as there was no severe COVID illness. One study that I did read, which was kind of interesting, was a Northwestern study that was published back in May, where they looked at placentas of mothers who were vaccinated versus unvaccinated. And the vaccinated mothers' placentas had no difference from the background patient population. So there were no placental lesions or problems with maternal vascular malperfusion, which we see in patients who have COVID infection. We do not see those changes in patients who are vaccinated.
Mm-hmm. Yeah. So the next question has to do with breastfeeding. Do we have any information about the effect of vaccination on breastfeeding? Because many mothers prefer to do that, and it's a good thing to do. So do we have any information about that? Any positive or negative information about vaccination and breastfeeding?
We do. So although there haven't been specific trials of breastfeeding women entering to get vaccines or not vaccines specifically, there were tons, like thousands of women who were breastfeeding during vaccine trials, and there were no adverse effects found on any of those moms or babies. So we believe it is very safe to breastfeed your baby and be vaccinated for COVID. We also know that that close contact during breastfeeding, if someone has a COVID infection and has been unvaccinated, is really dangerous for babies. And so being vaccinated, we think, is much, much safer than any potential risks that there could be.
All right. I think we probably should maybe get into some of the bad news that that unfortunately we've had to deal with, and that is what happens when a pregnant patient gets COVID. We hate to talk about this. You know, it's very disturbing sometimes. But what is it like to take care of a pregnant patient that has COVID?
I think it's really scary. Like I said, we've had more than several moms with COVID infections in their pregnancy. And because their immune system is different, because they're pregnant, they tend to get a lot sicker a lot faster. So someone who is not pregnant or not immune compromised with a COVID infection may do much better than a pregnant mom. And we also always have two patients to think about. So there's the mom with the infection, and now there's the baby who's been exposed to this COVID infection as well. And we've had some really sad outcomes. I think the hardest part of my job is telling someone that their baby has passed away. And I've had to do that several times during the pandemic because of COVID infections. There's no other explanation. There's no other reason than the mom was so sick with COVID infections. And if I could prevent that from happening to anybody else, that would be a great thing.
Yep. So Sarah, you had to deal with the outcome of those situations. What does that look like from your perspective as a pathologist?
Yeah, so we have seen a handful of cases, and so these are really rare cases where, you know, mom gets severe COVID illness and has stillbirth. In that setting, we have had to look at placentas from patients who have had stillborn babies. Most of these women are in the later second or third trimester. And when we look at the placenta, it's a very unique appearance to the placenta. At first, we had really never seen anything similar to this, and we sent a few placentas out to Cleveland Clinic to an expert to say, you know, we think that this might be what's been described as congenital COVID-19 placentitis, and will you weigh in on if you think it is? And they overwhelmingly agreed with the fact that they were these placentas were indeed what's been described in COVID-infected mothers. And what it is it's like a very severe maternal vascular malperfusion of the placenta. So the mom is not able to deliver that nourishing blood to baby via the placenta. Mostly this is because of an inflammatory reaction within the placenta. We can document that there's actually COVID virus in the trophoblast of the placenta, and sometimes we can even identify it through PCR in the amniotic fluid, that there's COVID virus particles floating around in the amniotic fluid. So basically it's the placenta and potentially baby become infected with COVID as well. And so the placentas often have, because of this inflammatory reaction, a lot of fibrin deposition and thrombosis as well. And they have a very characteristic look to them. Again, we have not seen that appearance in vaccinated individuals, in those placentas of vaccinated individuals, just in mothers with this severe COVID illness. And so, you know, at the beginning of the pandemic, this was something, as you know, that we pathologists had never really seen before. It wasn't a pattern that had been described before with other viral illnesses. But now that we have seen it, it's readily identifiable when we do see it. And so, yeah, it's really something that I hope no mother has to go through. Like Amanda said, it's devastating for us to see these placentas because, you know, this severe COVID illness can be prevented with vaccination.
That's just so sad. It makes me want to do whatever I can to prevent that from happening. So when we talk with people about these kinds of issues, are there some resources, Amanda, perhaps that you direct patients to that will give them some good information, at a patient level where people can read about this and understand it and make a better decision?
Yeah, I really like that college I mentioned. So the ACOG, or the College of Obstetricians and Gynecologists, has put out a lot of really nice patient educational material. It's really easily accessible online, and it's very readable and brief, which I also like. That's probably my favorite resource. We have a lot of discussions with our patients too. So I think another important resource for people to consider is their OBGYN. I think talking to your provider one-on-one and being able to ask your personal questions is really invaluable as well. But if someone wants to look online, I like the ACOG website the best.
Mhm. Good. Is there anything else, Sarah, that you maybe referred to or thought that was quite nice and quite well done?
So, I think that for myself, initially, I talked to my infertility doctor. He was a great resource for me. He really encouraged vaccination. My fertility center's website had a lot of good information as well initially. But I've often gone to the CDC recommendations. I think that they're very good. I've also looked at the ACOG recommendations and patient materials that they've put out, as well as read some primary articles myself. But, one of the things that kind of resonated with me as a patient when I talked to my fertility doctor is he said, Sarah, if COVID vaccination was going to cause infertility, so would COVID infection. And so that really resonated with me because, you're making a protein, you're making an antibody to a protein that is present in the virus. So if that antibody, could cause infertility, then you would see that in COVID infected patients as well. And so that was something that kind of resonated with me, and I understood as a patient as well as a physician. And then just, personally, I think just preventing the risk of really severe COVID illness is what I think is most important. And so I think when you are a patient and you're trying to weigh the risks and benefits, I think that the risks are so high for COVID infection compared to any risk that you could have with the vaccine.
Yeah. Thank you so much. This has been so valuable. Is there anything else that either of you want to add as people think about this issues? People are concerned, they're anxious, they're trying to make the right decision. Any other information or helpful hints for them to work through these issues?
I just had one other thing. I know I've frequently asked question in my office has been about miscarriages. And I know we talked a little bit about infertility, but maybe not specifically about miscarriage. So I just want to mention there was a really good study in the New England Journal of Medicine comparing the regular rate of miscarriage in all women to people who were vaccinated against COVID. And there was no increase at all in the rate of miscarriage. In fact, it was slightly lower for those who were vaccinated against COVID. So I just want people to also be reassured that we've really been looking at this from every angle, and we're very confident that the COVID vaccine doesn't impact becoming pregnant, carrying a pregnancy, or negatively on the pregnancy itself. So, and again, I just would encourage people to talk to their providers and be open about their questions. I think that's the only way we're gonna be able to make an informed decision, is to really talk about it with each other. So I hope that people feel comfortable doing that with their providers.
Yeah, and I agree. I totally agree with Amanda. Talk to your providers, and I just want to encourage people that, I think that your concern and, questions and fears are totally understandable. I think that it's, for women who are trying to get pregnant or pregnant, you have the responsibility to be informed before vaccination. And also, I think it's important that you're asking these questions and listening to this recording so that you can become more informed. So I would just say that I think that your questions are valid, and don't be afraid to ask them.
Well, thank you both so much. This has been wonderful. Thank you for your professional expertise that you've shared with the viewers, and thank you for your personal stories and your own experience. This has been extremely valuable. So thank you so much. And I think we'll close now, and perhaps we can revisit this topic later, get together again. And if there's new things that come up, this has been great, and I would like to do this again sometime. So thank you again.